Okay, so we have the ventilator set up now to use on an adult patient. So we're going to turn it on, this green button here. Wait for it to start. So now that it's on, you're going to see some options here. So current patient, new adult, new pediatric patient, or new neo. So we're going to choose new adult. So we're going to click that. It'll say confirmation will discharge current patient, which is fine. And then we're going to press this button here to accept. So then we're going to see this screen, which is our standby. It'll say standby, patient not ventilated. This always shows up, this alarm. It's just reminding you to perform the device and breathing circuit check, but that is already done. So we'll just click alarm reset, and then down at the bottom, click to confirm. So there's some options in here. So what we want to do is go into ventilation settings. So we'll click there. So up top is our modes. So we have our volume control, assist control mode. There's a pressure control, assist control mode. And then there is some other options like PSV or spontaneous modes. So we're just going to talk about ventilating on a volume control, assist control mode. So our options that we have here to set are going to be our FiO2. So if we wanted to change it, we would click it, turn this knob here, and then we also have to click to accept so that we see that it's changed. And if that service date reached or anything shows up there, you just press alarm reset and click. So here, the next one to set is our tidal volume. So again, for these settings, you're going to get an order from the physician for what to put in, and then we're going to set them here. So let's say that we want to set our tidal volume to 500. We're going to turn down, and then we're going to click it. So when we're on here, you can see here that it tells you on this volume and this rate what our minute ventilation is going to be. And our next thing that we're going to set is our inspiratory time. So that, again, when you click on it, you're going to see I to E ratio. So it's telling us currently it's 1 to 2.9, and then it's going to tell you what your exhalation time is with that. So this, I'm going to set at 1, and then our respiratory rate is currently 14. So you'll notice if I change my respiratory rate, it's showing us a little box down here, because if we're changing our rate, we're also changing our I to E ratio. So you got to remember to look at that. But again, you should get all of these settings as an order. We won't touch our slope at all. And our Pmax is just our max pressure. So we'll leave that at 40 where it's set to. And then our last one is PEEP. So again, we can increase it if we wanted to and click to accept. So under additional settings here, we have a trigger. We generally leave the flow trigger where it's set at 2. And then auto flow, it should default to on, so it is on. So once we have those settings set, we can exit out of here. And then if we're ready to start ventilation, we would hook our tubing here. So now that we have our circuit, we could take the cap off and we could connect it to our patient. When it's connected to our patient, so I'll just use a test long here. Then we can start ventilation. So we'll press start. Again, it's yellow, so we have to accept it. And then our ventilator is going to start. Now, because I don't want to overinflate this test lung, I'm going to turn this down. So now that we have our settings here, we're going to get values up here. So these are all our measured values. These are what we set, and these are what we measure. So another thing we need to look at is our alarms. So when we go into our alarms, we want to make sure that, so right here we have, sorry, if we look here, down here it's telling us what our minute ventilation is set to. So it's set to 4.8. When we go into our alarms, our lower limit alarm is 5.8, so it's gonna alarm. So we just want to make sure that we set these lower than what we're giving, and make sure the higher one is not too far away in distance. And then in here we have our respiratory rate. So the high alarm set to 28. You just want to make sure we're giving 16, that it's above what we have set. And then this is a tidal volume alarm. Same thing with that. So it's our tidal volume's 300 and it's set quite a bit above it. So we just want to make sure our alarms aren't going to continuously alarm, and they'll alarm when appropriate. So in here we have our peak inspiratory pressure measured, and then you'll notice here it's blank and we're not measuring a plateau pressure. So if we want to get a plateau pressure measured, then we have to go in and do a manual inspiratory hold. The patient can't be spontaneously breathing. Then you're going to have to press and hold it. You'll see a line there. Then you're going to stop. Then you're going to hit freeze waveform. So a number will pop up there, 19, or you can roll the style over and measure. So it's going to look a little different on an actual patient. You're going to have a little peak here, and then it's going to go kind of a lower plateau pressure. So this number, ideally, plateau pressure should be less than 30, and PIP should be less than 35. Here we're also going to have our mean pressure that we chart, and we also have a measured respiratory rate. So here it's set at 16, but if the patient is breathing above, you'll notice that number changes. So this is, there we go. So our rate of 26, say, or whatever it's reading there is what it's measuring. And then here is what we set. So the spontaneous respiratory rate is measured here. So it'll tell you kind of the difference. And so any alarm that is no longer active will show up at the top like this. So we'll hit alarm reset, click. So down in here, this is the measured exhaled tidal volume. So what we have set as 300 and what this is reading here should be fairly similar. This is our minute ventilation. So we do have it at 4.8, but it will change. For example, if our patient starts breathing, that number will be higher. And you'll also see that this number can change depending on what kind of breath our patient takes. And then in here, we'll notice we have our I/E ratio that we talked about earlier. So again, ideally you want your inspiratory time to be less than your expiratory time, and it'll show you what is being measured in there. And then this is also tells us a percent leak. So if there's a leak around the cuff, if the ET tube was a bit small and we have the cuff inflated, there could still be a little bit of a leak. A leak could just be in the system. So when you disconnect or when you inline suction, you'll generally have a leak there as well, but it should go back down. And then we have just our measured FiO2. So generally the things that we chart are a combination of what we've set and then what we measure. But for all of these settings that are inputted as well as the measured, if you have any questions about it, you should be talking to the physician.